Hello, we have the privilege of having Dr. Swamy Venturupalli. How'd I do?
Great.
He's a rheumatologist from Attune Health. Welcome.
Thank you.
Thank you for being
Thanks
here.
for having me.
Of course. So your practice is really exciting and new. Can you tell me a little bit about the ethos of your practice?
Sure. So starting in 2017, we had the opportunity to build out a brand new clinic in Los Angeles. We built it from scratch, and the way we did it was that we had the patient in mind when we built it out. So it developed as a place where patients can find solutions for autoimmune diseases and inflammation. That's what we specialize in. So we have been very active in the research arena. So we have been able to do a lot of clinical trials successfully. And what's happening in rheumatology now is that the whole field is moving to this concept of precision medicine. We want to be able to predict which patients will respond to certain medications. We want to be able to predict which patients may actually do okay if left alone, and which patients will actually need more aggressive management. So bringing those sorts of scientific discoveries to patients, that has become possible now. And in our clinic, we created a place for collaboration. And in this clinic, we have collaboration between the medical team and the medical staff, and between the whole medical staff team and patients, who have a very important role in what we're doing. We're using new technologies like social media, engaging with our patients online, so that we can understand what their needs are, what they're talking about, what's important to them. And we're also engaging with the general global rheumatology community through social media and other avenues, and bringing in cutting-edge research directly in our clinic to the patients. So I would say, to encapsulate what we do, I would say it is precision medicine brought to a patient in a very personalized fashion. And that's what we're striving to do.
That's incredible.
Thank you.
So we're real collaborators in care with your patients.
So every aspect of the clinic has spaces for collaboration between patients, between providers, between scientists, between researchers, between visiting professors and our research staff, between interns, medical students, fellows. So we're all moving in that direction, and what we were very fortunate to be able to do was to create a space where everybody could get together. And
it does feel that way when you walk in. What made you want to become a rheumatologist?
So, you know, both my parents were doctors. I grew up in India, and I always felt that a doctor was, you know, important for a patient, to be able to see a patient as a whole person.
Yes.
And to address that aspect. So that's why I went into internal medicine. But I also wanted to have a focused area. And in choosing a focused area, I did not want to limit myself to one organ or one system and say, okay, I just deal with the heart, or I just deal with the kidney, and sorry, you got something else going on, that's not my problem. I felt rheumatology really addressed that aspect, because we take care of our patients no matter what happens, whether it's a neurological problem, whether it's a cardiac problem, a lung problem. So among the specialties of medicine, I feel that rheumatology really is the closest to internal medicine in its purest form, which is what attracted me to it.
Yeah, because there are so many. You have one main disease as the trunk of the tree, and then there are so many branches that can happen because your other major organs get involved, especially if you've had the disease for a long time.
Especially in conditions like rheumatoid arthritis or lupus or other autoimmune diseases. Still's disease, absolutely. So, you know, the systemic aspect. So, for example, a patient may have arthritis, but they're actually they're presenting with severe fatigue, which could be a systematic complaint, but you know, the treatment really is dealing with the immune system, which is at the center of everything.
Yes. And I know you have a special area, your focus, you're really passionate about something, a specific?
Yeah, so within rheumatology, I have a specific interest in lupus as well as myositis, where I do research clinical trials. I also have an interest in Sjogren's syndrome. I'm doing clinical trials in rheumatoid arthritis. But what I'm really passionate about is to be able to educate my patients that there are things that they can do for themselves, including nutrition, diet, and exercise, to help how they're feeling, to prevent bad complications of conditions that they already have, and to actually get better in some cases. And some of these changes that we're seeing, some of these insights that we're actually gaining from treating our patients with this approach have been really encouraging. So some of our patients have shown dramatic improvements in inflammatory conditions that they present with when we have added a dietary intervention, to their program. I mean, they were failing multiple medications and they continue to have active inflammation. And we were like, okay, listen, how about we try this? It's an innovative approach. It hasn't reached a point where it can be universally recommended to every patient as being a cost-effective way to, manage your condition. On the other hand, as an adjunct, why not? It's a question of why not, hey, do it only for this reason, etc.
Well, there's a polarization between Eastern and Western medicine among doctors and among patients, when to me as a patient, it's both. You have an integrative treatment plan.
Well, yeah, at the end of the day, if you think about it, we as rheumatologists are here to help our patients get better. I'm open to using whatever technique it is that will get me that result, as long as it's safe. So
acupuncture.
I'm open to using these in a clinical practice. Now, on a population level, when I stand on a podium at the ACR and say, use these methods, I feel that I need to have more evidence for that. And I think that it's important that we start somewhere, which is what we're doing in my clinic right now, but ultimately the goal is to show through research that we can actually improve our patient's condition using this approach.
Do you believe that autoimmune conditions are curable?
That's a good question. I personally, I think they're not totally, I think they are absolutely curable in the future. When that future is, I'm not sure, but I'm hopeful, seeing how technology is advancing, that day is not too far when we will be able to examine a patient, draw some blood, understand the exact genetic profile of their condition, and prognosticate as to where they might end up, and then use that genomic information that we obtain to then choose the right treatment strategy, and then also use environmental modification, because we are learning that the genes themselves do not predict who gets disease and who doesn't. So for example, even in twin studies in patients with lupus, the level of lupus, like if one twin had lupus, the other twin doesn't necessarily get lupus, because there's an environmental component to turning on the genes that can cause lupus.
Can you give an example of an environmental component?
So an environmental component could be that a virus, for example, Epstein-Barr virus. There's a really interesting oral presentation about how Epstein-Barr virus is implicated in a majority of cases of relatives of lupus patients who then progress and got lupus. So that's an example. Smoking is another example in rheumatoid arthritis. That you can have the genes for RA, but only if you smoke. Those are the people who get RA.
Interesting.
Other environmental toxins. So there's a lot of work to be done. We don't know all of the environmental factors, but then we know that stress plays a huge role in flaring up of symptoms and pain. Sleep is huge. And I think nutrition is huge. I think the diet that we consume, it can be pro-inflammatory or anti-inflammatory. So having all of these modalities to work together, I think, is the way to go.
Absolutely, yeah, absolutely. I mean, you're preaching to the choir here. Yeah,
I know. Yeah, you've had a long struggle, and I know it's awesome the way you've been able to maintain your health, and that's great.
Well, I have an amazing team, and so I feel very blessed and lucky to.
I think you hit on the right word, which is team, because I think situations where patients feel that you know, their doctors need to be doing everything, doesn't work. And same way when doctors feel like, you know, we're not getting results because the patient hasn't followed certain things, that doesn't work. At the end of the day, I think we need to, again, take a step back and say, why are we doing this? And that's really to make our patients better.
Yeah, absolutely. Yeah, completely. I mean, yes. I agree. Well, thank you so much. It's such a privilege to talk to you and to have you here.
Absolutely, it's my pleasure.
And thank you for all the work you're doing.
It is my pleasure.
And I'm sure I'll see you. I'm sure I'll see you soon.
Absolutely.
Thank
Take
you.
Care.
You too.
All right.
Thank you.
Great.